The president's health care proposal has many critics. One is the president's former personal physician, Dr. David Scheiner. Dr. Scheiner is a Chicago doctor. He treated President Obama for more than 2 decades. He says the president's health care plan will not work because it's too expensive and too compromised. Doctor, it's great to have you with us here. You know, I think a lot
Thank
of
you very
people,
much.
I think a lot of people got to be surprised that you know, you spend 2 decades with your patient, and now you're a little disappointed, to say the least, with his health care plan. Why so?
Well, you know, I have tremendous respect for him. I think he's incredible. He may be the best president that I've been living through, and I go back to Franklin Roosevelt. But on this issue, I think he's wrong. And I think, well, I think on this particular issue, I think he's wrong. He is extraordinarily bright. I mean, the man is incredible.
Right.
His knowledge. Once I told him a joke in the office last time I saw him, and he remembered that I had told him the same joke, and he criticized me. If you can remember dumb jokes, this guy's got a memory. Yeah, he's got a memory, but what's his vision? And that's the issue here. You say this plan is too expensive and doesn't go far enough in the sense that it isn't sufficiently universal, isn't sufficiently nationalized. In what way? Well, you know, there's a number of areas. For example, one area that really bothers me is Medicaid. One of the things that he wants to do is to increase Medicaid. Now, Medicaid, the states can't afford it right now, and how they're going to afford it if he increases the size of Medicaid, I can't understand. Medicaid is also not a good system. Most doctors won't take them. Many hospitals won't take Medicaid patients, and the patients are treated often in a third-class fashion. That's not the American way of life. We're supposed to be more egalitarian. Medicaid is bad. The other thing is that the private insurance companies will still be driving the cart. And private insurance companies, I've had 40 years of dealing with them. People keep saying, well, the government will get in the way of between you and your patient. The government never gets in the way. In Medicare, 40 years of Medicare, they've never interfered with me giving care. Private insurance is constantly, constantly interfering.
Medicare is interfering? I'm sorry, which is interfering?
Medicare never interferes. If anything, Medicare is too permissive. There's too many things they allow that they should not. They should tighten it up. Private insurance tells me what hospital, what laboratory, what medication, whether I can admit the patient, whether I can't admit the patient. It's incredible. But
the argument is, as you know, Doctor, that that with government-run health care, that there would be great intrusion by the government, and the government, you mentioned Medicare, is 35% more expensive over the past 30-some-odd years than all of the other private programs combined per patient. So that's not a very likely model either. So what would be the two
except Medicare is treating old people. Medicare is treating old, sick people. They're going to have the great amounts of cost in the last 2 years of one's life. It has to be more expensive. So my question is, what are the 2 things you would like to see done, the top 2 requirements for successful health care reform? I know there are many more, but just the top 2 because we're out of time. Well, the first one would be universal Medicare, so that everyone is covered and there's no difference between different patients. The second thing, I think, is we've got to address the issue of the pharmaceuticals. This is getting way out of balance. We have to negotiate the fees for the
So you're talking about price controls for pharmaceuticals?
Not cost controls, but it has to be, Part D was a disaster. It was so expensive. There has to be negotiation. Right. All right. Well, Dr. David Scheiner, good to have you with us, and maybe you should call up your former patient and talk about maybe a beer at the White House to get this thing resolved. I wouldn't mind a glass of water. You got it, Dr. Scheiner. Thank you very much.